If you're over 60 and worried about your memory, this video is for you. The earliest signs of dementia are often not about just being forgetful. There can be subtle changes in mood, judgement, or everyday tasks that are easy to shrug off. I'm going to share 5 early dementia signs that are often missed, even in busy clinics, and how to talk to a doctor if they sound familiar. This isn't about scaring you. It's about giving you straightforward information so you can get help sooner if you need it. First, just a quick reminder, not every memory lapse is dementia. As we get older, it's normal to walk into a room and forget why we went there, or to occasionally forget someone's name and remember it later. What worries doctors more is change. When a person starts behaving differently from their usual self, and it keeps happening or gradually getting worse over months and years. So in this video, don't focus on isolated moments. Instead, listen for patterns and changes from someone's normal personality, normal abilities and normal routines. With that in mind, let's look at 5 early signs that often fly under the radar. Sign number 1 is personality and mood changes. Sometimes these show up before any obvious memory problems. Someone who's always been calm and easygoing might suddenly become more irritable, suspicious or anxious. And someone who's normally sociable and chatty might start withdrawing, avoiding phone calls or saying no to things that they used to enjoy. You might hear family members say things like, "She's just not herself lately," or "He's becoming really snappy for no reason." It's easy to blame this on stress, bereavement or old age grumpiness, but when it's quite a big change from how that person has always been and it doesn't pass after a few weeks, it can be an early sign that the brain is struggling to cope. If you notice this kind of shift in mood or personality over several months, it's worth taking seriously. Sign number 2 is quiet problems with planning and everyday tasks. This isn't forgetting once to turn the oven off. It's when tasks that used to be easy and automatic start becoming confusing or overwhelming. Maybe someone who's always managed the household bills starts missing payments or double paying the same bill. Maybe they struggle to follow a familiar recipe or can't keep track of appointments, or suddenly find using the remote control or their mobile phone much harder than before. You might start seeing piles of unopened posts, missing direct debits, or repeated calls asking you to remind them of something you've already explained. Again, any one of these things could be down to distraction, stress, or just a bad week. What matters is that when it's new for them and it keeps happening. When everyday organising and planning starts to slip in a person who used to be on top of things, that's a red flag. Sign number 3 is changes in judgement and risk awareness. This can look very different from person to person, but the common theme is that they start making decisions that don't fit with their usual personality. For example, someone who's always been careful with money might start giving large amounts away, or signing up for things over the phone, or falling for obvious scams. They might begin buying strange items they don't need, or agreeing to contracts without really understanding them. On the safety side, they might leave doors unlocked, turn the gas on and forget, or go out at odd times of the night without clear reason. Families often say, "Mum's become far too trusting," or "Dad's been really careless lately." Underneath, the part of the brain that weighs up risk and consequence may not be working as well as before. When someone's judgment suddenly shifts like this, it deserves attention. Sign number 4 is changes in language and communication. We all have days where we say, "Oh, what's that word? It's on the tip of my tongue." They can be perfectly normal. What I'm talking about here is a pattern of growing difficulty finding words, following conversations, or expressing thoughts. You might notice someone using very general phrases instead of specific words, saying "that thing" more often, or pointing rather than naming objects. They might lose a thread in group conversations, answer with short, vague replies, or repeat the same question several times without realizing they've already asked it. They might start speaking less, not because they have nothing to say, but because talking feels harder and more tiring than it used to do. Sometimes this gets blamed on hearing problems or not listening, especially in busy, noisy environments. But if you notice a real change in someone's ability to follow and join in conversation, that's worth mentioning to a doctor. Sign number 5 is getting lost or confused in familiar situations. It's one thing to take a wrong turn in a new town. It's another to get turned around on a route you've walked every week for years. Examples might be missing a usual turn on the way to a local shop, feeling confused in a small supermarket that they've used for a decade, or suddenly not remembering where everyday items are kept in their own kitchen. At home, they might seem unsure which cupboard things go in, or they might mix up rooms they've known forever. Again, it's the pattern that matters, repeatedly getting lost or confused in places that used to feel automatic. So if you're listening to this and thinking, "that sounds a bit like me," or "that sounds a lot like my mum or dad," what should you do? Well, the first step is not to panic. Many other things can cause similar symptoms like stress, depression, poor sleep, infections, vitamin deficiencies, medication side effects and more. Some of those are treatable and reversible, which is why it's so important to get checked rather than assume the worst. When you're ready to speak to a doctor, try to be as specific as possible. Instead of saying, "I'm a bit forgetful," you might say, "Over the past year, I've noticed I'm missing bill payments and getting lost on the way to places I've known for years." If you're a family member, you might say, "Mum's personality has really changed. She's more suspicious and withdrawn than she's ever been, and she's been struggling with her money and the appointments." If you can, write down a few examples before the appointment. What's happening, how often, and how long it's been going on. It can also be helpful for a relative to go along and share what they've seen, because the person themselves might not notice or might feel embarrassed to bring it up. You're allowed to ask direct questions such as, "Could this be mild cognitive impairment or early dementia? And can we do some memory tests or a referral to a memory clinic?" You're not being awkward or dramatic. You're advocating for your brain health or for someone you love. I want to finish with a bit of reassurance. This video isn't here to diagnose you, and it's not here to make you frightened of every slip and tumble. It's here so that if something really is changing, you don't ignore it for years. Early recognition gives you the best chance to rule out other causes, get support in place, and protect independence for as long as possible. If this video helped, stay with us here at Senior Health Today for more clear, calm guidance on life after 60. We're building a growing library of practical, no-nonsense health advice for you and your family. Take care of yourself and your mind, and thanks for watching.